Stop. Take a breath. Before you panic. Before you Google your symptoms. Before you convince yourself that something is terribly wrong. Because if you're dealing with back pain right now, the question quietly haunting you isn't just how do I fix this? It's something deeper, something scarier. Is this serious? Is something actually wrong with me? Every day, millions of people feel that fear the moment pain shows up in their back. A sharp twinge when bending. A deep ache that won't go away. A sudden spasm that stops you in your tracks. And instantly, your mind goes to the worst possible place. Disc damage, nerve injury, surgery, disability. I'm Dr. Martinez, and today I'm going to help you understand something that most people never get clear answers about: how to tell the difference between back pain that feels scary and back pain that actually is serious. Because here's the truth most doctors don't take the time to explain. Most back pain is intense, disruptive, and frightening, but not dangerous. And at the same time, a small percentage of back pain really does require immediate medical attention. The problem is that no one ever teaches you how to tell the difference. So people either ignore serious warning signs or live in constant fear over pain that their body could safely heal. Let's start with something that might surprise you. The intensity of your pain does not determine how serious it is. Some of the most painful back episodes people ever experience: spasms that drop them to the floor, pain that makes it hard to breathe, are actually benign, self-limiting, and non-dangerous. Meanwhile, some of the most serious spinal conditions begin with pain that feels mild, vague, or easy to ignore. Pain alone is not a reliable signal of danger. Your nervous system is incredibly powerful. When it senses threat, real or perceived, it can amplify sensation dramatically. That's why a muscle spasm can feel catastrophic, even though no tissue is being damaged. It's also why fear itself can make pain feel 10 times worse. Understanding this distinction is the first step in calming both your body and your mind. Now let's talk about what doesn't automatically mean your back pain is serious. Disc bulges, disc degeneration, arthritis, and wear and tear sound terrifying, but they are extremely common and often completely unrelated to pain. By age 40, most people have disc changes whether they hurt or not. These findings describe aging, not injury. They are not emergencies. They are not a sentence to lifelong pain. And they are almost never a reason for panic. Another thing that feels alarming but usually isn't serious is pain that comes on suddenly. You bend over, sneeze, twist, or stand up too quickly and suddenly your back locks up. The pain is sharp, intense, and shocking. Your first thought is that you've thrown your back out. In most cases, what actually happened is a protective muscle spasm. Your nervous system detected a sudden movement it didn't like and responded by tightening muscles aggressively to protect you. It feels dramatic, but it's rarely dangerous. Pain that gets worse with movement and better with rest is also usually not serious. This type of pain suggests mechanical sensitivity: muscles, joints, fascia, and nervous system guarding, not structural damage. It means your body is reacting to load or motion, not breaking down. That distinction matters more than most people realize. So if pain intensity doesn't determine seriousness, what does? This is where we need to talk about red flag specific signs and symptoms that suggest your back pain may be more than just a common musculoskeletal issue. These are not meant to scare you. They are meant to give you clarity. One of the most important red flags is loss of bowel or bladder control. If you suddenly can't control urination or bowel movements, especially alongside back pain, that is a medical emergency. This can indicate compression of critical nerves in the lower spine. This is rare, but it is serious, and it requires immediate evaluation. Another major warning sign is progressive weakness or numbness. Not tingling that comes and goes, and not mild numbness after sitting too long, but true, worsening weakness. If your leg is giving out, you can't lift your foot, or numbness is spreading rapidly, that needs attention. Stable symptoms that improve with position are usually not dangerous. Symptoms that worsen and don't improve are different. Unexplained weight loss combined with back pain is another red flag. If you are losing weight without trying, feel constantly fatigued, and have back pain that doesn't change with movement or rest, this deserves further investigation. Pain that is constant, deep, and unrelated to activity can sometimes point to systemic issues rather than mechanical ones. Night pain is another clue, but it's often misunderstood. Pain that wakes you occasionally when you roll over is very common and not serious. But pain that is constant, deep, and wakes you every night at the same time regardless of position can be a sign that something more is going on. Context matters. Fever combined with back pain is also important. A mild fever from a cold alongside back pain is not concerning. But persistent fever, chills, and back pain together can signal infection and should not be ignored. Now here's something crucial that most people never hear. The absence of red flags is far more meaningful than the presence of pain. If your back pain fluctuates, responds to position, changes with movement, and comes and goes, those are all reassuring signs. Your body is responding, adapting, and protecting, not failing. Let me tell you about Mark. He was 38 years old and came into my office terrified. He'd woken up with severe back pain that shot down his leg. He couldn't sit. He couldn't sleep. He was convinced he had permanent nerve damage. His MRI showed a disc bulge. He was already planning surgery in his mind. But when we talked, his symptoms changed with position. His strength was intact. His reflexes were normal. No red flags. His nervous system was sensitized, not injured. Within weeks of calming that system and restoring movement confidence, his pain faded. No surgery. No damage. Just fear that needed reassurance. Now contrast that with another patient I'll call Linda. Her back pain was mild at first, barely noticeable, but it didn't change with movement. It didn't improve with rest. She felt increasingly fatigued. She lost weight unintentionally. These were subtle signs, but they mattered. Further testing revealed a serious underlying condition. Her pain wasn't dramatic, but it was persistent and unchanging. That difference saved her life. Serious back pain often doesn't shout. It whispers. It stays constant. It doesn't care what position you're in. It doesn't flare and calm. It just sits there, quietly demanding attention. That's why understanding patterns matters more than intensity. Another thing people worry about is pain that radiates down the leg. Sciatica sounds terrifying, but radiating pain alone does not mean your condition is serious. Nerves are sensitive. They can become irritated without being damaged. Pain that moves, changes, or centralizes over time is usually a sign of healing, not harm. What matters more is whether nerve symptoms are stable or worsening. Improving symptoms, even if slow, are reassuring. Symptoms that steadily progress despite conservative care deserve evaluation. Here's something else that causes enormous anxiety: hearing or feeling a pop. Many people assume a pop means something tore or broke. In most cases, it doesn't. Joints cavitate. Fascia shifts. Muscles release. Sound does not equal damage. Pain following a pop is usually protective muscle guarding, not structural failure. Let's also talk about age. People over 50 often fear that back pain automatically means something serious. Age alone is not a red flag. Pain patterns, associated symptoms, and response to movement matter for more than how many birthdays you've had. So how do you know when to seek immediate medical attention? Seek help urgently if you experience loss of bowel or bladder control, rapidly worsening weakness, numbness in the groin or saddle area, severe trauma like a fall or accident, or back pain accompanied by high fever and systemic illness. These situations are uncommon, but they matter. For everything else, the question isn't, is my pain serious? It's, is my nervous system feeling threatened? And most of the time, the answer is yes, not because you're injured, but because your brain is trying to protect you. Your brain's job is survival, not comfort. When it senses uncertainty, stress, fatigue, or unfamiliar sensations, it tightens muscles, heightens awareness, and increases pain. This system is incredibly good at keeping you alive but terrible at knowing when to calm down. That's why reassurance, education, and gentle movement are so powerful. I want you to understand something deeply important. Being concerned about your pain does not mean you're weak. It means you're human. Pain is one of the strongest signals your brain can generate. Of course, it grabs your attention. The goal is not to ignore pain, but to interpret it correctly. Most back pain is a false alarm, not a structural emergency. But false alarms still feel real. They still deserve compassion, care, and smart guidance. Here's the final truth I want to leave you with. Serious back pain is defined by patterns, not panic. By progression, not fear. By associated symptoms, not MRI language. When you know what to look for, uncertainty fades, and with it, a huge portion of pain itself. Your body is not fragile. Your spine is not failing. And most importantly, pain does not automatically mean danger. Knowledge is the antidote to fear. And when fear decreases, your nervous system can finally let go. Listen to your body, but don't let fear be the interpreter. When you understand the signals, you regain control, and that's where real healing begins. Subscribe my channel to not miss upcoming videos.